Hello, my name is Neil Ward, and I'm going to do a demonstration on subcutaneous medication injections today. First, I'm going to gather my supplies. I've got hand sanitizer, I've got sharps container, I have medication, I have my tuberculin 1 milliliter 25 gauge 5/8 inch syringe with the red cap. I've got alcohol prep pads, I have gauze, and I have gloves. I'm going to check my orders and verify my orders. My order is 1 milliliter or 1,000 milliliters of heparin, which is a blood thinner. I look at my 6 rights, the right medication, the right patient, the right dose, the right time, the right route, and the right documentation. So far, everything looks as it should be. So I'll gather my supplies and go to the patient's room. Provide privacy. Hello, Mrs. Patient. How are you today? Patient says she's fine. I explain my name is Neil. I'm going to give her the doctor ordered a heparin shot, which is a blood thinner. I explain what a blood thinner is and how it can prevent clotting. I perform hand hygiene. I put my gloves while I'm talking to the patient. I ask the patient for her full name and date of birth, and I compare it against her wristband. I also compare it against my MAR. All three seem to line up. There's no issues. I explain the reason for heparin is to thin the blood out and prevent blood clots in her veins or her arteries. I ask her if she has any allergies to any seasonal allergies, food, medications that she's aware of. Patient says no known allergies. Great. I explain that side effects of heparin might cause easy bruising or slow bleeding, meaning like if she had a cut, it might be a little bit slow to clot up, to bleed, to clot up the cut. I also explained that adverse effects could be dark stool, tarry stool, meaning blood, occult blood in the stool, or that she might see blood in her vomit, blood in her vomiting. The last two are extreme cases, but if she does see any of those, to let me know. She says okay. She understands. To let me know if anything that happens right away so we can help her. I explained that with any injection, as normal, she might be a slight stinging or pinch or burning at the site. She says aware, no problem, that she understands. And we say okay. So I'm going to discard my gloves now. Perform hand hygiene. Put on another set of gloves. And I'm going to start to prepare my medication. Again, I'm going to check my orders. I have, in my vial, I have 10,000 milliliters, or my concentration is 10,000 milliliters per every 10 mLs. So to get 1 milliliter, I'm going to give her 1,000. I'm going to give her 1 milliliter of the solution to give her 1,000 milliliters or 1,000 units or milliliters of the heparin. I have my syringe, I have my gauze, I have my wipes. So I'm going to take my heparin. I'm going to take a pad, an alcohol pad. I'm going to clean the top of it. I'm going to let it air dry. While that's air drying, I'm going to open up my needle, discard the trash. I'm going to exercise my needle and take it to 1 milliliter, which is down here. I have 1 milliliter of air. Now that my medication rubber stopper is dry, I'm going to take my needle and I'm going to put it in and I'm going to inject the air into the vial. I'm going to flip it over and I'm going to withdraw a little bit more than 1 milliliter. See any air bubbles? I do not. I'm going to push it back up to be exactly 1 milliliter. I currently have 1 milliliter of solution. I'm going to recap my needle with one hand. And now I'm going to inspect her site. We're going to do the lower abdomen. We could do the back of the arm, but since she's laying down, the lower abdomen is probably more important. I'm going to inspect the site, look for any bruising or any hard spots. I'm going to palpate, see if there's any tenderness or soreness in the spot that we've chosen. There is not. So I'm going to now take a fresh alcohol pad. I'm going to wipe from in to out about 5 centimeters. I'm going to let that dry. While it's dry, talk to the patient, make sure she's comfortable. Okay, now that the site is dried, I'm going to take a pinch. I'm going to pinch the site about 1 inch or so. I'm going to measure and see that I have enough skin and tissue that my needle will go into the subcutaneous area. It does. So I'm going to take my needle off. I'm going to hold my needle like a dart, redo my pinch, and I'm going to go in at about a 45 to 90 degree angle into the site. I'm going to inject, and I'm going to watch over a 30-second time, inject 1 milliliter of heparin. Starting now. Alright, that's 30 seconds. I'm going to pull my needle straight out. I'm going to put it in my sharps container. I'm going to let go of the skin. I'm going to put a piece of gauze on it. I'm going to see if there's any bleeding or any damage to the site. There's not actually. There's no bleeding. She looks like she came out pretty good. I'm going to collect my trash, put it away. I'm going to take off my gloves. I'm going to perform hand hygiene. I'm going to thank the patient for allowing me to do this. Implore her again to let me know if there's any complications or if she feels anything or notices any extra blood in her stool or her vomit. She agrees. I gave her her call light. I say thank you very much. I go back to the med room and I document that the right patient at the right time got the right dose and the right route and the right medication and the site of the injection and the integrity of the site. Did it, was there any complication from the skin from the injection? I document no, and that's the end of the procedure. Thank you.